chief medical officer and worked in the emergency department at Hurley for years and has seen what this type of service will do. I'm going to close with I believe the first one of these was opened in Kent County, Network 180. They partnered with a hospital, so they had a little bit of a head start on us. This was last year, so Debbie Stabenow, Senator Stabenow, was at the opening, and when somebody asked her what she thought this meant to the behavioral health field, she said, and this is supposedly a quote, she said, "This is really a big effing deal." I've been told by numerous people that she really said that, and I don't think I could say anything more than that, so I will leave it at that. So, Jen.
Good morning, everybody. At one time in Genesee County, there was really not a lot of options for people who were having a mental health crisis. If there was an emergent situation, it had to rise to a certain level of emergent, and really, at that point, the only option was hospital or jail. There wasn't a lot of other choice. During the pandemic, we opened a virtual behavioral health urgent care through a grant. I look back, I wrote that grant in 2020, so here we are 5 years later, and those services still continue today. We offer virtual support 24 hours a day, 7 days a week, 365 days in a year. As soon as we were able, we opened a physical site location, which is where the urgent care sits right now today at 422 West 4th Ave, right across the street from Hurley. And what we know there is that the first couple of weeks we offered support to just a handful of people in the first 2 or 3 weeks. Now, on an average day, they may see between 15 and 20 people, and they're open 7 days a week. So the need is growing, and the need is great. And we're really excited to be able to have a facility such as this where we can really support our community, where people have a place to go any hour of the day. And when a person's having a crisis situation, we're able to preserve their dignity and make sure that they are getting the support they need during some of the most vulnerable times of their life. We'll gradually open the facility that you're going to walk through shortly over the coming months, and in there you'll see a lot of options for care. So we'll have same day in and out care available to all ages, where people will be able to receive individual on the spot therapy, linking to resources, psychiatric evaluation, and we'll be able to help people get what they need and get back out to their regular daily community and get them the support and resources to keep going. On site we'll also have for adults 18 and up, a crisis stabilization unit where people will be able to stay for up to 72 hours. They'll receive behavioral health care within the first few hours of arriving from professionals who specialize in that type of care. And we're going to help them get stabilized and identify what the next steps are in their journey. As a step-down option, we'll have an 8-bed crisis residential unit where people will be able to stay for up to 14 days. Adults will be able to receive a lot of intensive support and in an extended way to help them really stabilize and identify any longer-term ongoing care needs that they may have. Through our partnerships with our first responders, we will offer police and ambulance drop-offs. You'll see the area where that will happen in the facility, but right here in the parking lot, they'll come directly around the corner to do that drop-off in a private and secure way. The staff work areas will focus on adaptability and ensure that we have a focus on wellness. You'll see in there that the workspaces offer a variety of options for our staff. We have a growing group of very special people who want to do this work with us and join our staff team. And I want to really thank them today because they're doing a lot of the hands-on work in the moment, supporting people during some of the most terrible times and challenging times of their life. I really believe that they save lives every single day when they're doing this work, and so I have no doubt that we're going to keep doing great things together. I want to quickly thank our facilities and construction team. I know Dan mentioned some of them. They put their heart and soul and work tirelessly in this facility to make it a welcoming environment, and I really can't wait for you all to see it. So thank you.
Good morning.
And right on cue, our Sheriff Swanson is here.
Come on in. Your seats up here. Your seats up here.
Just about 13 months ago, I received a note on my desk, and it was, there's two sounds that if they go together, this is what we do. That was the first sound, and the second one didn't come, so we're good. And I saw this note, and it was written in by somebody who appreciated some of the work that the Office of Sheriff has done, and it had a phone number. And with all the things that were going on in my life at the time, I knew that if I didn't call right then and there and thank them, that it would probably be lost in the business of life. And so I made the phone call. And the individual's driving down I-69, and I could sense how he was talking. There was something much deeper going on in his life. And I simply asked the question, "Are you okay?" And he wasn't. By God's grace, the note that he left me was left days before, but my call was perfectly timed. He was having a mental health crisis. And he had a family, and he just happened to be at Saginaw and 69. And I said, "Bro, where are you exactly?" And he goes, "I'm at the stoplight at Saginaw and 69. I said, "Do you see the Sunoco station?" He said, "Yeah." Pull into there. I called one of the sheriff's deputies. I said, "Go get this gentleman. He's in the parking lot. He's driving a truck, and bring him here." Came to the sheriff's office, and you could tell he was having a crisis. You could see physically that there was a stress beyond all measure. So I started to call and to get help. And in a county this size, 5th biggest in the state, we didn't have then what we have right now. Jails in America have turned into mental health hospitals. Ironically, if you think about jail population, you think it's those folks. But 9 out of 10 of them, including Genesee County, are addicted or co-addicted. 6 out of 10 have an undiagnosed, worse yet, mental health crisis. Half of them cannot read a menu. And to have some place where we have a walk-in ability to take people in crisis that's not a hospital and is not a jail is exactly why we're here today. And under the leadership of Dan Russell and all those that are here, as the sheriff, I thank you for making this day happen. This gentleman had a crisis that we would love to have walked in and said, "We're going to help you." I brought in some faith leaders. We were able to get him the diversion that he needed. But what he had that day, all of us at one point of our life have that day. Mental illness is a stigma. You teach it during our CNT training. Our supervisors that go to different houses throughout the county see it firsthand. What we're doing today is not only just ribbon cutting a new opportunity for people in crisis, but also awareness for people. To wherever you are, look for those days of somebody driving down 69 and getting off at Saginaw Street. Look for those signs and say, "Are you okay?" And now that we have a place to take them, we can get them the help they need. This is a model throughout the state. This is a gem that we have, but it's much needed. So to all those that make it happen, to all law enforcement, to our schools that are being represented here, and also to GHS staff, you made an investment in this community, into people's lives and children whose lives will not only be serviced, but you will change generations because of the help that you're offering and the path to restoration that you're giving. So thank you for everybody being here and getting behind that mental health is not an obstacle. It is something that we can use to propel people to a great future. We're going to do a great work. Thank you, Dan Russell. Congratulations. Thank you.
Thank you, Sheriff. You brought the rain with you when you leave. I hope it goes with you also. Is Dr. Reeves here? Okay, well, we will go on our next. So we were just talking before. Dr. Yeager and I got here about the same time in Flint. He got here just a little before I did. We, in the early years, had a lot of conversations about this particular topic. Not all of them were particularly quiet. So, Dr. Michael Yeager.
Thank you. Well, thank you. I will keep it brief because, this is a big deal. This is about as big as it gets, especially for the community and all the folks that we take care of on a day-to-day basis. You know, it's easy though when your missions align, and I think all of our missions here are very much aligned. In healthcare, that doesn't happen that often, where everybody has the same common goal, and that is taking care of patients that are in crisis. And Mr. Dan has said, we've had these discussions for decades, and it's been 30 years in the making of getting something like this, and this place is amazing, and I just simply walked through it. But the idea to include our law enforcement folks and our pre-hospital people and having social work services out in the field is a game changer for sure. So I mean, I already know this is a model system throughout the state and probably the country by the time it's even up and running, is really an incredible service. The one thing we will tell you is that it is, we are always going to be available in the emergency departments, and I know I speak on behalf of our professional colleagues at the other hospitals in the county. This is a big deal for all of us. This is a game changer for the care delivery of patients with mental health crisis. We've been saying all along, it's the right patient, the right time, the right place, the right therapy, and this is actually the place. So we're super excited to partner and continue our long-standing partnership with Hurley for sure, and our pre-hospital teams that are all here, and certainly the therapists and social workers that are really the backbone of all of this. At the physician level, you know, our work is quite easy compared to all of yours. I got to tell you that. We're usually at the end of the care continuum, so it's kind of simple. I hate to say it, but we certainly can see the demand for this service, the need for this service, and I think it's going to be a game changer for the community, as Sheriff Watson said. So, you know, Chris, you said it all. There's not much I can say after he gets up here. So, I appreciate the opportunity to thank everybody on behalf of Hurley and our staff. We've been a longtime partner in this quest of providing behavioral health services. So, with that, I think the hurricane is on its way, and I'm turning this back over to the boss. So, thank you, buddy. I appreciate you.
Dr. Reeves, now make it.
I don't see her.
Okay, Dr. Reeves. Okay, Dr. Reeves was going to be here just to thank you for your attendance and your support on behalf of the DHS board and the community as a whole for the support of the community health millage. We would not be able to do this without that. And this is, I think, as the experts you've heard from, this is going to be a game changer for the community. So, again, thank you everybody for coming. And just whoever on staff decided to have a tent, good decision. Okay, Dr. Reeves is here. We're here in just a couple minutes from. I do want to recognize somebody who is now just part of the audience, Mr. Dan Kilby. Dan, thank you for coming. Dan was a big supporter of this project while it was being developed and advocating for funding for it. So thank you, Dan. Good to see you. Okay, now.
Come on in. There's space here. Come on in. Fill in the space.
Okay, so I will turn this over to Dr. Andrew Reeves. Dr. Reeves is the treasurer of the GHS Board of Directors.
Good morning, everyone. I'm Dr. Angela Reeves. I am a board member, and on behalf of the GHS board, I want to welcome you to this wonderful event. I could not be happier and more proud of the staff and all of the work that they did, because you have to know this was not an accident, right? I'm going to add that a little bit. Okay? This was a result of deliberate planning. It took the support of your legislators. It took the support of the County Board of Commissioners. It took the support of you. because you voted for the Genesee Health Center's millage plan. And that's what's making this emergency care center possible. So I want to say thank you on behalf of the board, because this could not happen without your vote. Your vote matters. Now you can applaud yourself now. Okay. We are so proud to bring this level of care. It's a new level of care. It is a level of care that has been something we wanted to see for a very long time, and it's just such a wonderful thing to bring it to our community. So on behalf of the Genesee Health Systems, I almost said Systems Board, I want to say welcome again, and thank you so very much for your support. Appreciate it.
All right, it's time to cut this ribbon under this tent and get inside. So that's what we're going to do. At this time, we're going to just move the podium out the way. We're going to do the little ceremony, cut the ribbon, and I'm going to rip that ribbon down so everybody can go inside. Is that good? So give us a few seconds just to set up the photo op for the ribbon cutting. Once we're done with that, please run inside.